Analyze for a minute the relationship between the core and the lower back. The reason we're going to talk about this is because it can be your strongest or it can be your weakest part of your body. The stronger is because when you're a baby, one of the first movements you do is to roll from your back to your belly using the core. Due to our lifestyle, our tendencies are to go to the anterior tilt, which you will see sideways is more of the tightness of the lower back, the shortness of the hip flexor, the tightness of the quad, and the weakness of the butt, being all in relationship of this whole area. Our goal is to go to a posterior tilt, which is lifting the hip bone, so you're lengthening the quad, lengthening the lower back muscles, and engaging your core for an overall protection and control of your whole body here, and making this part, instead of the weakest, the strongest part of your body. I see exercises in 3 levels. The rehab exercise, because you didn't know and you injure yourself. The prehab exercise, which is a new idea of preventing before it happens. And the enhancing exercise, which if you want to go to a more athletic level of fitness. But let's start with the rehab exercises. I'll have 5 exercises for you to do on a daily basis. Let's start with some exercises from the floor. The goal of this exercise is to make your core to do most of the work, pulling the hip bone up towards the ribs as you press your heels down into the floor to gain the lift. The detail of this exercise is that you want to start from the lower spine and go in a sequence from one by one vertebrae at a time. From the bottom to the top on the way up, from the top to the bottom and the way down. Sometimes we will have a difficulty of moving through the sequence because the tightness on the lower back are already pinching nerves, and it's too uncomfortable, or you're feeling the pain that's uncomfortable to do the exercise. So we can use a wedgie like this to already promote the posterior tilt of your back right from the start. But you can use this, or you can use just a lift on your sacrum there to help you to have this tilt already. Okay? So you're just gonna help me here with the sequence to see if you can see it correctly.
Pressing your heel down to the ground, gently start tilting the pelvis. Remember the cannonball belly button up and in. and the vertebrae, one at a time. Very slow movement. That's why it's difficult to see the movement on Ricardo's body. He's lifting up gently. Chest up, shoulders down. Let's use the conscious body flow here, up along the front and down along the back. And then slowly he's coming down, again from the top of the vertebrae to the down. Slowly and gentle. Be cautious. Utilize all these points, the heel, the belly button, and as you reach the point. Now coming up again, pressing the heel, lifting up. Look at the pelvis, the belly button's up, the chest is coming up. There is always room for improvement, and this is a constant practice. And he's coming down gently, vertebrae by vertebrae, all the way.
This is the most challenged part of it, because you need to press the upper core and the mid core to be able to move the parts of your spine that don't want to move.
And that's the relationship, the front and the back. As he is lifting this up and bringing down the back and down. Give a little moment on the ground to feel the sensations along your spine. Some of you may feel more, some of you may feel less. The good thing is you're feeling it.
The next exercise is going to be a side rotation. We're going to use a foam roller. If you don't have one of these, you can use a yoga brick or a towel or a pillow or something that you can press the inside of your knee into the foam roller. You're going to stretch from your heel to your head. You want to keep the alignment of the spine comfortable too. So a lift for your head also helps. So I'm going to press the inner thigh in, push my stomach in, and then rotate the shoulder back and forward.
Now if you look at Ricardo, his top leg is on an angle. Make sure to fit to your body to the foam roller.
Like a 7:30 p.m.
And observe that he's also pressing his heels towards the ground to give him further support. Also observe that his belly button, see that improvement right now? Belly button up and in. He's twisting from above the belly button. And his hips stay right here by the stabilization with the foam roller. And he's twisting the upper body. This feels really good. You can add a little breathing in there while you feel it. Let it out. And you can do about 5. Slowly feeling the sensations.
Let's do the other side.
And switch. Same setup. Make sure again that you have the support that's necessary for your head. So observe the position of his head here, the body again, the angle on the leg, on top of the foam roller, utilizing your heels to help further support, stabilize the pelvis. And look at the improvement we're gonna see right now, belly button up and in. You can see that, chest up, and add the breathing in there. Make it feel good inside your body. Might be challenging. That's because we have to work little things within us. Once you finish the 5 out. You slowly undo.
Next exercise, you're gonna do a dome on your core. We start belly down and the elbow slightly behind your shoulder. With the pressure of your elbow on the floor and the knees supporting in the bottom, you're gonna take a big inhale, and as you exhale, you're gonna take the air out of your stomach and lift yourself up like if you're shaping into a dome. Inhale the way down.
Observe that the flow is still happening while he's doing the movement to get to the dome. Still up along the front and down along the back. He's utilizing his chest and his upper back. Observe now in this wave like the dome being created, belly button up and in. He's also using his toes to support and his heels still going towards the ground. So conscious body flow, up along the front, down along the back. And lifting up along the front and pressing down along the back.
Now there's a possibility that when you're doing these exercises, you could be lifting from here. So you're just gonna fix
belly button up and in. Use the toes and the heels to
slide the hand
to support
up
you.
along the front.
Then up along the front, down along the back. Integrate all your body parts over here to support you to be in the right position.
So even if you start this way and then you fix along the way, this will work. But it's always better to already start the right way, so you don't have to fix along the way. And you can do from 5 to 10 exercise repetitions on this one.
Look at all the details, the toes, the heels, the back of the legs, on the front of the body, his quads is lifting up, belly button up and in, chest up, again shoulders down. He's utilizing the angle of his elbows with the shoulders. Even his fingers are supporting him. The position of his head by looking down, not put pressure on the neck, is also very good. He's looking right at his fingers. So practice that. It will give you tremendous relief.
You can finish on the child's pose to make your body more compact here, and then your butt will start coming closer towards your heel.
May feel a little challenging to do the belly button up and in on this pose, the child's pose, but as you can see Ricardo lifting up, he's adjusting his body not to compensate on his form. So belly button up and in, and again, the flow is the easier way to position all the body parts. Up along the front, down along the back, lifting up along the front. As you cannot see his movement, he can feel it, and pressing down along the back. This might be happening in a micro level, very little, very, very subtle, but feel it and breathe in there if you can. Slowly, your bottom is gonna come closer to your heels and you feel more comfortable on that position. Make it feel good.
As you strengthen your core muscles and lengthen your back muscles, there is a very intrinsic muscle that starts from the inside of your leg, go through the hip and attach to the 5 lower vertebrae. His name is psoas. Anyways, psoas get tight because we sit too much and then it gets stuck with the other muscles inside, and it needs to open and slide through them. So use the foam roller to start stretching the quad muscles to be able to allow the core muscles to stretch and be able to lift the hip bone. So this is one
Or gentle.
of the things that you can do here.
Continue using the flow.
Now to get more into the psoas, now apply the foam roller by the very lower part of your core in the beginning of your hip bone. You want to allow the foam roller like a slope, and your body is going under this way, so the foam roller is pushing the hip bone up in this direction. It might be uncomfortable in the beginning, so don't put too much pressure. In the scale of pain from 1 to 10, by number 7, you can take the treatment. If you're fighting the treatment, you're already going on the wrong direction, which would be more like a struggle level of pain of 8, 9, or 10. So don't go beyond 7, which you can take it. And to further go into the stretch, you want to allow the foam roller to sink into your belly. So you're stretching the psoas.
Let your body melt on top of the foam roller. Use the flow and breathe there. If you are uncomfortable, think where your breath can go inside your body. As you can see, as Ricardo is breathing, his body is gently falling over, giving room to the foam roller to do the work on the psoas.
This length helps me to extend my hips and lift my core and lengthen my back. Now we're going to do some back rolls. Now this exercise is good to massage the muscles on your back as you work the muscles on your core to hold your spine stable. The first level will be you keeping the leg close to you so you don't let the hip to be pulled from your leg. Okay, so keep the leg close, and again the sequence is going to play a major role on this exercise. You want to go from the lower vertebrae to the upper vertebrae and back. You can use the momentum of the exercise and always correcting your posture with the flow.
Observe that everything is all in a round shape, so there is no bumps when it comes down.
Yeah, a bump will look like this and this. So this creates more tension on your back, so we want to avoid that the most. If you feel comfortable on this exercise, enough strength, then you can move on to a no-hander. You can land back in the beginning, but again, as you gain more strength, you'll be able to hold your balance.
Observe his belly button is up and in. He's using the heels as also another supporting system, and the chest is up, even though he's rolling and come back up. You see the improvement there? Very good. Now there you go, belly button up and in, chest up, back go down towards the ground, using the heels as support. Breathe there. And once you start to feeling a little tired, so you start to compensate, losing your form, then take a break before you resume to another round.
Again, all those exercises are good for rehab and for prevention. However, if you want to enhance, then you can go more into something like this.
Now that his body is stable and he practiced the other two, he can increase and progressively challenge his ability. Pay attention to all the details. The flow is in, up along the front and down along the back. As he rolls, he uses the belly. The belly is controlling this motion in going back and lifting up and come back and change the position. He's using his heels, the big toe, up along the front. All the muscles in the front of the body are lifting up to support his lift, and all the muscles in the back of the body are pressing down. And this keeps this balance, as you can notice.
Again, all of these exercises are made for you to get stronger. So if any pain goes beyond level 7, you should stop, relax, rest, and then you can start over. Try to do all this exercise on this sequence because I have planned this for many years, so that's what has been working for now. Okay, so as we move through the exercises, the last one is going to be the windshield wiper. Again, if your neck is this way, it's better that you have a support, so you're not putting any pressure on your upper vertebrae, like your cervical or your thoracic. Okay. Arms are extended on the side. In my case, I can extend the back on the spine, so I won't need the pillow like some of you won't. And you're just gonna drop the knee from side to side. Again, using the flow, pulling my stomach in, lengthening my lower back, letting muscles on the side to stretch.
It should feel good. The palms are up. His shoulders and his upper bodies stay connected to the ground, centrally moving the belly button and the pelvis gently from side to side.
If you want to go into a more advanced motion, then you can extend the leg. That's when your body is ready for a little bit more weight to lengthen your lower back muscles.
Notice that he's pulling in from the belly button's up and in, then he rotates. There is a little bit of a transition in the middle, in the center where he adjusts his hips. Make sure to do that. So it feels good and you're warming up all of that area. Observe that his hands are still facing up and his shoulders is still both up towards the ground.
You can alternate about 10 or 5 on each side. And for enhancement, and you don't have more any pinch or any lower back issues at the moment, you can then give it a little hip and add a little bit more movement in the exercise. That requires a little bit more agility, comes from your core.
He's using more of his upper body and his belly and allowing his legs to be light, using the heels to support. Again, the flow is working all around his body to support this movement, and he could increase the speed without compensating his form. You could also do for, instead of 10 for each side, if you would like a little bit more challenge, increase the heart rate, you could do for either 30 seconds or even a minute. Thank you for watching. Keep it up with your practices, whether it is preventive, you are rehabbing, or you are enhancing. Thank you for watching.
This is exercise that you can do on a daily basis. So don't worry about overtraining. What we need is to catch up what we're losing. And this seems to be one of the biggest problems that I see in most people that I work with, in general, what I see the people on the streets. So work on your core. That's your strongest part of your body. When you feel don't, it could be the weakest. So keep up the good work. Have a good day.
The power of your belly.